So let's talk about the areas of where the sciatic nerve can actually get irritated. Now, the sciatic nerve is actually one of the longest nerves in our body. And if we look at the path, every corner, everywhere that it runs is a potential for it to get kinked up. So let's start from the beginning. The sciatic, the 3, 2, 1. So let's talk about the areas of where the sciatic nerve can get pinched or irritated. Now, the sciatic nerve is one of the longest nerves in the body. And so it's pretty common to have multiple locations for that nerve to get impinged and irritated. So let's start from the beginning. The sciatic nerve actually all begins, 3, 3, 2, 1. So let's talk about the many areas of where the sciatic nerve can get irritated and pinched. Now, the sciatic nerve is the longest nerve in the body and extends all the way up from our brain down to the bottom of our foot. And what that means is that it crosses many joints and many structures, providing opportunities for it to get pinched and irritated. So let's start off initially up at the brain. Now, it often is actually going to be either the starting point or the end point of all our sensations because it's where we process all of our information. And so our brains are divided into both sensory and motor, and the sciatic nerve provides both sensory and motor innervation to our leg. And so that's area number one. And then we'll actually travel down our neck where it runs down our spinal cord. And so in some cases, there are folks who can actually irritate parts of their neck and they can actually present with symptoms a little bit lower. Most of the time, we're looking at a little bit more concerning in regards to a possible spinal cord injury. Don't want that to happen. So if you notice that your neck is actually influencing your pain compared to everything else, be a great opportunity to ensure that you're getting a full clearance from either your medical provider, whether it be a doctor, physical therapist, or chiropractor. So possibly we're looking at the possible neck area, and it can get kinked up as well. We then move on into our thoracic spine. And the thoracic spine, one of the interesting things about the thoracic spine is that it's actually encased with our rib cage. And so there's not going to be a lot of motion, but in some cases it can either be overstretched or it can be a shortened position and get a little sticky in this specific area. And in some cases, we're going to want to be able to loosen that up. So again, we're looking at head, neck, thoracic spine. We then move on to the most common area of sciatic nerve irritation, and that's going to be our back, our low back specifically, because we have our spine, we have our discs, and we also have our nerve foramina. Now, I've talked a lot about the anatomy of the low back, but the general rule of thumb is that it could either be an irritated disc, a herniated disc, prolapsed disc, but also you can be dealing with what is called central canal stenosis, which is often due to disc herniations and irritation. But the other area that we could also be dealing with is what we call foraminal stenosis, where the openings of your nerve actually allows that nerve to travel down your leg. And so you'll notice is that your back will impact your sciatic nerve based on your spinal position. So if you're bending forward or if you're bending backwards, side, or you're twisting, that has an impact on your pain. And if that movement has an impact on your pain, you'll know that yes, your back and spine is probably incorporating into that. We then move on into our hip area. Now, this is an area that often gets overlooked. And so oftentimes when people think, okay, you're having issues with your hip, you got to do bridges and clamshells and do all these stretches. But ideally, what ends up happening is that the sciatic nerve runs through your glute, and it goes under, below, or through your piriformis, depending on what your anatomy is. And then the function of this hip will actually, whether it be moving enough or not enough, is going to impact the kinking in that sciatic nerve. We then have the nerve travel down your hamstrings. So if you have perpetually tight hamstrings, or if you just sit on the monkey bars for a long period of time, there's a lot of pressure right here in the back of your hamstring, it can also irritate the sciatic nerve. We then move on to the crease of our knee. The crease of our knee usually bends and extends, but in some cases, if you deal with the trauma, you can actually experience some irritation of the nerve there as well. And then as we run down, we go into our calf. Now, this is an interesting part because once we cross the knee, the sciatic nerve will actually split into a couple different nerves. You have your tibial nerve and then you have your fibular nerve as well, which actually will then supply. One interesting thing is that the sensation on the inner calf is actually not supplied by the sciatic nerve, but it's actually supplied by the saphenous nerve, which actually comes a little bit higher, supplies your quad. And so what we're looking at is just identifying where are those nerves getting kinked up. Could it be the neck? You can actually influence your neck position. Could it be your upper back? Could it be your mid back, your low back? Could it be your hip? And so the goal when it comes to pain management, especially when it comes to dealing with sciatica, is trying to figure out where is the location of pain, but then also how to address it.